Hi, my name is Kennedy Agee, and this is my audience.
1, 2, 3, 4.
Today, I will be speaking over anterior cruciate ligaments, also known as the ACL, with their tears and their cadaver reconstructions. The ACL is an important ligament for knee stabilization. When you have an ACL tear and that occurs, it must be reconstructed for the knee to work properly. The anterior cruciate ligament is called the ACL normally, just because it's such a big word to say. It's key for stabilization of the knee. It connects at the femur and the tibia, and pain upon injury is normally felt in the back and center of the knee. Post-injury pain is normally on the inside of the knee where the ACL is actually located. And after you tear, normally there is presented swelling. The importance for ACL is stabilization and proper function of the knee. Surgical repair is required once a tearing, and most of the time is done with cadaver reconstruction. Recovery period after an ACL tear can be anywhere from 4 months to a maximum of 9 months. The importance for knee stabilization. Their ACL is responsible for rotational movements such as cutting and pivoting. It prevents your knees from hyperextending, which is the excessive straightening of your knee at its joint. The cause of injury for ACLs is most commonly it happens during sporting events or physical activities, and it's normally seen when a person pivots, cuts in a forceful way that is most of the time unstable and they're not on balance. It is also caused by overcompensation on landing, and commonly happens in girls more than men because of their quad to hamstring ratio. Your hamstrings are an important part of your ACLs, and when your quads are stronger than your hamstrings, it allows more pressure to be put on your ACL instead of on your legs. The reconstruction surgery is performed using allograft cadaver tissues. The reconstruction is a complete replacement of the original tissue, which the cadaver ligament. This particular surgery is performed arthroscopically. Surgery takes approximately an hour to an hour and a half to complete. The reconstruction procedure. Up here on the screen, I have a picture of the incisions. For arthroscopy, there's normally 2 to 3 incisions that are made on the knee. Incisions can be anywhere from 1 inch to 2 inches in length. Once the incision is made, a sterile solution is pushed through the incisions to wash out any blood and to clear the surgery site. That way the surgeon can clearly see what he's working on. Here is a picture of the arthroscope that he places through one of the incisions. The surgeon will then insert the arthroscope into one of the top incisions that is made. There's a camera placed at the end of the scope, and it displays a picture onto a monitor. That way the surgeon can see where he is working and what exactly he is working on. The other surgical tools are placed through the other 2 incisions to perform the operation itself. Here is where we get to the cadaver insertion. Up here in this picture that is a picture of an ACL ligament. That is a cadaver, which is a ligament taken out of a donor's body once they have passed away. So the surgeon will drill holes into the femur and the tibia bone, and the original ligament will be removed and a new ligament will be inserted through one of the incisions. The new ligament is threaded through the holes that he drilled into the bones, and he anchors it to the bones. That way it stays in place. They anchor the ligaments to the bone using screws the majority of the time. The surgeon then he cleans up the area and fixes any minor issues made upon injury, because sometimes when an ACL is torn, nicks can be presented in other places such as the meniscus or other ligaments. Here is a photo of a reconstructed ACL. So you have the anterior cruciate ligament, which runs straight through the knee, and you can see at the top where there is the hole drilled for in the femur. Then there's the new ACL graft and the tibial hole that was drilled. Stitching. After surgery is complete and all the tools are removed, the surgeon applies stitches internally and externally. The internal stitches will dissolve on their own and eventually just leave the body. The external stitches must be removed after a few weeks, after the skin has healed and closed back together. And here we are to the recovery. Recovery differs for all people. Not everybody recovers the same. Patients are normally able to return home a couple hours after surgery as long as there are no complications. After surgery, most patients experience pain, tiredness, swelling, and that all can be handled with prescription medication, as well as your normal Tylenols, Motrins, and ibuprofens. Swelling is controlled with cold compressions and ibuprofen. It's important to rest after this type of surgery just because it takes so much energy and strength to get back from it. After about a week, most patients will go to physical therapy where they will recover and work to get their muscles going again, because once you tear an ACL, your quad stops functioning. Your ACL is the brain to your quad muscle. So once that ACL is replaced, you have to retrain it to start firing your quad again. A patient is normally on crutches for a few days after surgery, but after a few days, you begin walking on your own in whatever time feels best to your surgery. Full physical recovery can be accomplished as early as 4 months or could take up to 9 months as well. In conclusion, an ACL tear happens when the stress is placed on the ligament and an unequal ratio of quad to hamstring muscle strength. Reconstructive surgery must be performed, most commonly using cadavers and completely replacing the torn ligament. After surgery, the affected person will be recovering from surgery for up to 9 months while in therapy and beginning to continue to normal activities. Thank you, and here's my audience once again. Thank you.